Now we're going to talk about another lung disease or lung pathology. So this is what is known as the type 2 pneumocyte hyperplasia. Type 2 pneumocyte hyperplasia. So for the type 2 pneumocyte hyperplasia, right, so this is we have the type 1 pneumocyte, we also have the type 2 pneumocyte. So when you say something is hyperplasia, it's actually getting large, okay, it's getting large, none of that. Alright, so type 2 pneumocyte, first of all, you should know that it's a reactive proliferation of alveolar epithelial cells. So it occurs after lung injury. It represents the lungs' attempt to repair and restore alveolar integrity. So as lung injury is occurring, this one is coming behind and trying to actually what? Repair, do you understand? So type 2 pneumocytes, you know that they are specialized alveolar cells and they produce surfactant that serve as what? Reserve reserve cells for alveolar lining. So hyperplasia means those cells are actually becoming too much, mainly because maybe they are responding to an inflammation or so. Do you understand? So this is just what we got for this. Alright, so the process is reactive, not neoplastic. So it's part of the lungs healing mechanism. So causes and triggers is the type 2 pneumocyte hyperplasia can be seen in many conditions like pneumonia, sepsis, maybe there's vascular injury, maybe you took some toxic stuffs, interstitial lung disease, and acute respiratory distress syndrome. Alright, so pathology features is on the microscope you see enlarged cuboidal epithelial cells lining the alveoli. Okay, sometimes a prominent nucleoli to tell you that there is actually what? Hyperplasia. Alright, so sometimes can overlap with cancer. Okay, so diagnosis is basically pathology. You send some tissues to the lab, just to actually pinpoint it. Okay, so it's actually an indicator of injury and it's not really a disease itself. So when you see it, you now have to go on and check up what is actually causing the issue. Okay, so that's what we have for what? Type 2 pneumocyte hyperplasia.